Doreen Grand-Pichet is the
Dr. Doreen is an expert in autism. Doreen Grand-Pichet.
Dr. Grand-Pichet.
Dr. Doreen Grand-Pichet.
Dr. Doreen Grand-Pichet is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
Poppy wants to ask about medication. Her doctor just put her son on Abilify. That's all she said.
Yeah. Poppy, I am a pro-medication person. I'm not someone who says just medicate and then do nothing else. But I am definitely, I strongly believe that medication makes things easier. I can't really comment on your particular child and Abilify because I don't know anything about your child. But Abilify is one of the medications that a lot of physicians use, and it is helpful to some children. It's not really helpful to other children. So you just need to give it time and work with your physician and have a very open dialogue. And I will say that whether your child is experiencing ADHD, let's say, or hyperactivity or distractibility, or they're experiencing repetitive rituals, or they're experiencing anxiety, separation anxiety, or anxiety towards social, whatever it might be, that's a, I guess, side effect of having autism, or a symptom of having ADHD. Whatever the symptoms are, these medications can help take the edge off. But two things are always important. One is, once you've taken the medication and it has helped, let's say it's anxiety or depression or ritualistic behavior or attention deficit, try to also teach the child skills that will strengthen that particular area, and try to also do things that deal with the cause root. Like a lot of times our kids might be experiencing anxiety and we give them an SSRI and it helps them. And we also teach them behavioral techniques, cognitive behavioral techniques that will help them cope with the anxiety. But we don't actually ask ourselves, maybe my child gets anxiety because he doesn't sleep. Maybe my child gets anxiety because he eats massive amounts of sugar. So deal with the cause. Or maybe my child has anxiety because there's a horrible teacher in school who he's afraid of. So do all of those things. The medication and the behavioral or the cognitive behavioral treatments are great. They help you cope with the existing, but always, always, always ask what's causing it. Sometimes you can modify what's causing it.
She gave us a little bit more information. He does have ADHD, pretty severe, as well as level 3 autism. He is an ABA in speech and currently waiting on OT availability.
Yeah.
So those things will help.
Those things will help. How much ABA is he receiving? That's probably going to be my biggest question, because if you have pretty severe ADHD as well as level 3, I assume you're saying it's 3 autism, then you have a lot. You're dealing with a lot. And I would, regardless of his age, probably recommend a very intense, comprehensive program of ABA, which will help manage things. Otherwise, doing like 10 hours of ABA is not going to be sufficient.
There we go.
If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now. To subscribe, click here. And if you'd like to check out some more of our videos, click here. Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time on autismnetwork.com. We hope to see you there.